We're here to present our poster with the cancer rates in our Hep C population compared to a group of non-Hep C patients. We found that the cancer rates in the hepatitis C population during those 5 years, 2008 to 2012, was the crude rates were significantly elevated for a number of cancers. But when we looked into some of the confounders like alcohol use, tobacco use, obesity and diabetes, the total cancer burden was increased. Liver cancer was increased and non-Hodgkin lymphoma, but the other cancers did not reach significance. No, we know that, of course, from the past that there is a high rate of liver cancer in hepatitis C cirrhosis, probably related to the chronic infection. But hepatitis C has been associated with a number of other factors, oncogenes and tumor suppressor genes, but what's causing it, we don't know. We also have to interpret these results with a lot of caution because our population of Hep C had a very high rate of diabetes, obesity, cirrhosis, alcohol abuse and tobacco use. So there could be some issues with the confounders, and we may have missed other confounders that we didn't look at, and we cannot say that there's a causal relationship between hepatitis C and the cancer. I think there's two ways of seeing it. As the Hep C population has a high rate of alcohol use, tobacco use, etc., obesity, diabetes, we need to work on lifestyle changes. That's something we haven't been good at and doesn't happen overnight. I think we can at least take hepatitis C out of the equation. We can treat hepatitis C. It's a 3-month treatment and it's easy. We just have to make it available to most of our patients, and then the long-term goal should still be to work on the lifestyle changes many of our patients will need. This is a male dominance, but I think everyone should be treated, and whether they are young or old, and I think it's an even more stronger indication the older you get, because you've had the disease longer, and we may not have transplant as an option if the patients develop cancer or liver failure. I think that the surprise was probably that the rate, especially of liver cancer, was so high. It was almost 70 times increased. That is, and we see liver cancer every day. And we need to prevent development of cirrhosis, because it's in the group with cirrhotics that we see, and we need to, so we can treat patients before they have cirrhosis, and if they have cirrhosis we can treat them before they decompensate.